In 2008, my son was diagnosed with type 1 diabetes. At the time, he was 8 years old. This diagnosis not only changed our lives as a family, but it changed my son's life in a major way. For those of you that are not familiar with diabetes, according to the American Diabetic Association, there are currently two types of diabetes. The first being type 1 diabetes, which is considered to be genetically inherited. Type 1 diabetes is when the body does not make enough insulin because the beta cells, which are found in the pancreas, are not secreting insulin, or they're destroyed or damaged. Type 2 diabetes, which is considered to be curable with a healthy lifestyle and exercise, is when the body's blood sugars go too high, which is also known as hyperglycemia, or when the body does not use insulin properly. This can also be called insulin resistance. Because my son was given this diagnosis, our family knew that we needed to be educated. During the education process, we learned that our son would need to be dependent upon insulin for the rest of his life. Insulin is an important hormone that allows the body to regulate sugars. According to Endocrine Web, after a person eats, cells within the pancreas, or a gland that is located behind the stomach, secretes enzymes that help in digestion. During the digestion process, insulin is released into the bloodstream. We also learned that our son would need this insulin. This meant that he would receive insulin injections via needle or syringe, just like this syringe here, up to 6 to 8 times a day. The insulin would be given from a vial similar to this vial. We were educated on the different types of insulins that are used to treat type 1 diabetes, as well as we had to learn how to give injections. Another thing that we had to learn was we had to identify when my son's blood sugar was too high and when it was too low. High blood sugars are called hyperglycemia, and low blood sugars are called hypoglycemia. Hypoglycemia is when a blood sugar falls below 70. And a hyper blood sugar would be when the blood sugar is anything above 180 up to 2 hours after eating. There are several different methods in which a person could choose to treat hypoglycemia, which is low blood sugar. We learned that we could give him apple juice. We learned that we could give him glucose tablets, followed by a protein source, or we learned that we could use glucose gels. To treat hyperglycemia, we learned that we could simply take him for a walk to reduce his blood sugar levels, increase his water levels, or we could give him an injection of the insulin that I showed you earlier. The bottom line is, diabetes is a serious diagnosis, but we learned that life with diabetes is possible. It's different. Some accommodations may need to take place, but with education, eating healthy, having a balanced diet to include exercise, low carbohydrates, and low sugar intake, life is possible with the diagnosis of diabetes. Thank you for listening.